Hi, I'm Dr. Pete Campbellis, and I'm a medical director at Buckeye Health Plan. And today we're talking about care coordination, what it means, why it matters, and how it can improve outcomes for the people we care for every day. And I'm joined today by my colleague, Dr. Michelle Blanda, who's here to walk us through how care coordination shows up in real life and how we as clinicians can strengthen it. And Dr. Blanda, thanks for joining me.
Thanks for having me, and I'm so excited to talk to you today about care coordination. I think it's such an important topic when it comes to the patient experience, so I'm really looking forward to our discussion.
Okay. Well, let's start at the top. What do we mean when we use the terms care coordination?
So care coordination is about that organization and aligning of services across the different clinicians for a patient. It makes sure that everyone who's involved in the patient's care is on the same page, sharing the right information and helping meet that person's full health needs in a clear and connected way.
So why is this so important?
Care coordination helps prevent things from falling through the cracks. When you think about a patient who's sick leaving a hospital after they had a hospitalization, when they transition home, it may not go well. So care coordination provides guidance to help you know what to do, when and how to make sure your needs are met, when you are recovering from an illness, when you might need to go to the emergency room, when do you get your medicines filled, when do I follow up with the doctor. Those are all things that the care coordinator can help with.
Excellent examples, Michelle. And what might be some other specific ways that care coordination could improve outcomes?
Well, I think there are multiple ways that it does. First, it helps us see the patient as a whole. When we combine the history, the goals, and active treatments into one care plan, we're better prepared to deliver the right support. The other thing, it makes it easier for the patient to have access. When we help them with scheduling, referrals, and even kind of knowing who you're supposed to go to, there are tools like remote monitoring that patients can use so that they don't get lost in the system. When patients understand what's happening, they're going to be more engaged, and so their engagement is key. And last, it supports better transitions. We know that when members are sick or when patients are sick, that coordination of care helps them recover, it reduces readmissions, and it helps just build trust.
How can clinicians put this into practice? What might be some examples?
Well, I think one of the ways doctors can help patients is when they are there using the existing resources that are in place. So we all know that at a hospital, care coordination is built into the system. However, when the patient returns home, we need to make sure that we continue to build the support around them. And one of the things that happens is that the health plan can provide care management to help coordinate the care. As clinicians, we need to lean on the health plan, like Buckeye, to provide the support and tell your patients that the health plan is there and that they are going to call you, and therefore you should answer that phone call. Let patients know that you are working on the same team as their health plan to help them get the care they need when they need it. Every interaction matters, even something simple like calling after a hospital discharge. All those go a long way.
Absolutely. And we want to amplify to our clinician colleagues that we at Buckeye Health Plan, we are your partners in taking care of our patients. At the end of the day, care coordination helps us deliver better care and helps patients feel less alone in the process. It's good for outcomes, efficiency, and the experience we're all trying to create. Remember, Buckeye Health Plan is your partner in care. Michelle, thanks for sharing your insights, and thank you to everyone watching. Your work matters. We value you and your focus on whole person care. It makes a difference. And stay tuned for our next video in our patient experience series on how to help patients get the care they need.